This is Dr. Nilanjan Sengupta, Professor and Head, Department of Endocrinology, NRS Medical College, Kolkata. 21st June is observed as International Yoga Day. Yoga is a traditional, ancient Indian form of exercise that has very many benefits, not only on physical, but also the mental health of an individual. Regarding the immense physical benefits of yoga on metabolic health, it can be said that the current malady of obesity, diabetes, dyslipidemia, high blood pressure, or hypertension, all of them can be effectively tackled by exercise, apart of course from necessary medicines and drugs, but predominantly with non-pharmacotherapy too, of which exercise is an important component. Now, this exercise can be done in various ways. There are various forms of exercise, various versions of exercise, and it has regional and global variations too. The dominant Indian form of an exercise program is what we know as yoga. And as I said, just as exercise in general has benefits on metabolic health, being a metabolic physician, being an endocrinologist, I'm concentrating on metabolic health. Just as exercise has benefits on metabolic health in general, yoga, being a form of exercise which is very ancient, very traditional, and very effective, also has benefits on metabolic health, apart from many other things. So commonly these days, people suffer from obesity, diabetes, hypertension, dyslipidemia, fatty liver disease, polycystic ovary syndrome. In all these diseases, apart from other lifestyle measures, apart from appropriate drugs, exercise, in this case, yoga may help such patients. Now, there are various yogic postures. There are various yogic methods which an yoga expert can tell you. But the common exercises, yogic exercises like Dhanurasana, like Malasana, Vakrasana, Vajrasana, Ardhachakrasana, Padmasana, to mention some of the more well-known asanas. They have benefits on blood circulation and visceral health. Some have benefits on the liver, some have benefits on the kidneys, some have benefits on blood circulation and the heart, so on and so forth. But overall, yoga improves metabolic health, increases flexibility and muscle strength. So apart from metabolic health, now we come to the skeletal health. So yoga or exercise helps strengthen your body. Properly done, many of the yogic postures are in essence stretching and balancing exercises. So they have beneficial effects on the soft tissues, muscles, tendons, ligaments, and also on the bone. So overall, yoga has benefits on not only metabolic health, not only psychological health, but also done properly on musculoskeletal health. Of course, these exercises need to be supervised by an expert, and not all exercises, not all yogic exercises may be suitable for all persons, depending upon age, comorbidities, presence of other illnesses, patient preferences. One has to go for a prescription of yogic therapy under the supervision of an expert. Then only one can derive all the benefits of yoga. And needless to say, as with any exercise, this should be done properly, rationally, scientifically, and most importantly, regularly, to derive the benefits out of yogic exercises. Thank you.
Now we are ready to move on to Surya Namaskars, my absolute favorite for full body strengthening and flexibility. For this, we'll come to the front of the mat, joining the feet together, knees together, toes together, keeping the hands together in Pranam Asana. Let's begin. Take a deep inhalation, pushing the navel away, raise the arms up in Ardha Chakrasana. Gaze slightly up, try to take your hands back, feel your back working. And exhale, pull forward, fold. Now inhale, you take the right leg back knee down to Ashwa Sanchalan. Just connected to the knee, chin slightly up to plank position. Full body parallel to the floor, toe lifting one line, core engaged. And exhale, slowly put the knees down and chest between the palms to Ashtanga Namaskar. Slowly inhale from the front, relax your toes and sliding up to Bhujangasana. Make sure you're not shrugging your shoulders, shoulders are rolled back. Beautiful knee wash. Try to keep your heels down. You can bend your knees if you like. Now inhale, bending the right foot forward between your palms to Ashwa Samshalan again. Back knee down, back to relax. Chin up, move forward. Feel a good stretch in your pelvic. As you exhale, tuck the left toe again. Bring it forward in between your palms to Uttanasana. Fingertips and toes in one line. Relaxing the forehead. Now very slowly inhale. Lengthening the spine, raising the arms up, pushing the navel away to Ardha Chakrasana. Exhale. Bring the hands to the heart center and slowly release and back six hands.